So as an outpatient, they will not do a test unless you have some symptoms, because it is an expensive test. We are running short of tests. So if you have fever, cough, and there are questionnaires which I can provide you at a later in detail, fever, cough, body aches, and symptomatology, then you can go to one of these centers or one of your private urgent care center. They can do the test. The test is 30% false. It can be 30% false negativity, and it really depends on how the technique is done. It can be taken from what we call nasopharyngeal swab. It can be, nowadays, it can be done even from saliva and pharyngeal swab also. So the technique should be good. You should qualify for test. And still, even if everything is good, it can be negative. So don't be, some of these tests can be negative. Does everybody who's asymptomatic should get the test? No, they won't even do it. So that is about the tests. You cannot get positive after you touch something, because they are taking you should be infected in your nose and mouth area. So that's what, if your hand has touched something, that will not show up in the test. So your second question is how to prevent from, I didn't get it, like what to do?
Once we return back from outside after doing some grocery shop or something, what are the must do or necessary steps we should follow to avoid any infections?
I just want to, maybe I will start right from the beginning. This will be a part of my, some information. First of all, I really want to suggest, do not go out. Really, do not go out unless you have to. Like sometimes you really have to. You are part of essential work. You have to make your living, and if you have to go. But if it is unnecessary, don't do. Our Indian people, we have dal chawal at home all the time. They just shop every 2-3 weeks, through 2 weeks. Why am I saying don't go out? A lot of studies have shown that this is a droplet infection, and this is a droplet infection. And just imagine, after rain, you have humidity in the air. So these particles can suspend in air for up to 3 hours, depending on the size particle, and you are inhaling that air. So if you are so this can be a problem. And of course, guidelines are that you stay 6 feet, but some of the studies, which I know are not 100%, but it can go up to 27 feet. So you are in that atmosphere and you can be breathing that air. And a very good example is in India, in China, South Korea, Taiwan, they could contain this because they had strict rules to stay at home. We in America could not do it, and we are seeing some of the results, especially in New York City and some of the areas where stay at home and social distancing is not followed. So try not to go out, and especially I would say 65-year-old with comorbid, what we call, with other medical issues, hypertension, diabetes, and now they're saying obesity is also a major factor which affect patients with COVID. In NYU, some of the younger patients who unfortunately lost their life because they were obese, they didn't have high blood pressure, they didn't have any of the other comorbid conditions, they just were obese. So that's a very big factor actually. So this is going out. So what else? When you come back, when you are out, I strongly suggest you wear your mask, because the reason I told you just now, wear your mask. I'm going to go maybe later on what kind of different mask and what we can make mask at home. I know masks are not very easily available. You don't have to wear N95. You can make masks at home, and I'll tell you what kind of mask can be made at home, and even the what material to be used. So mask is important, really essential, because this virus goes through your nose, mouth, and it can actually goes through cornea. One of my colleague in UK got a case few days ago with conjunctivitis infection, ulcer. So I suggest, try not to wear contact lens and wear the eye protector. There are available, these eye protector are actually available on Amazon. You can buy it from the this construction, what this the stores which sell construction goods, and Amazon. They are cheap and they protect your eyes if you yeah. So that's eye protection is important. And of course gloves, if you can wear gloves, I think that gloves is a good idea, because our yeah, gloves is a good, especially if you're going for grocery shopping. So that's one thing. Some of the people ask me, how about petrol pump, gas stations? They are, oh, they are using gloves, so I'm safe. No, if somebody is using gloves in grocery stores or when they are pumping your gas, they are using it for their own protection. They are touching many hands and taking credit cards. So whenever you are using credit cards, make sure you are using gloves. You wipe the credit card or spray it with Clorox or bleach or whatever. So now when you come back to house, now people who are actually working and who have to go, when you come back, just imagine that if you are in humidity and that bacteria may be there on your clothes, wash. Just a lot of people have their washing machine next to their garage. Just try and remove all the outer clothing that are exposed to and put it in your washing machine. And I have a very interesting thing that I've experimented. If you are wearing gloves, some of the gloves, especially nitrile glove, I wanted to show you this, like blue gloves like mine, they can be washed. Actually, this glove has been gone through washing and drying for 4 or 5 times. So they survive washing and drying, as far as you make sure you take them out nicely, just put it directly into the washing machine, wash them, dry them. This works like an autoclave. In India, we used to autoclave our instruments and even gloves. So I experimented it, and it is nitrile glove. I don't know if all of these will be good, but you can give it a shot. So when you come, just remove all the outer clothing and put them to wash. Use color safe or bleach and wash them separately. So that is first step. If you're going out, if it is possible, I think you really should stay in a separate room. Because you can be a silent carrier. You can be carrying it. So there is a significant number of patients, people who can be a carrier. So why expose your family, and especially elderly, in the house? So try be in a separate room, wash your linen very often, and be careful handling food items. Don't go home and hug your children, and and if you have to sit together, I suggest you wear mask, because you may be exposed, you may be positive and you don't know, you may not have any symptoms. So maybe I think a better idea is wear your mask when you're close to your family member and sitting in a close area. Mhm.
Okay, thank you, Dr. Sudha, for all this information. We have got a lot of questions, so we'll try to be a little short and keep moving on. Another question I got is like, this is the allergy season also, the pollen allergy and all. So a lot of people have the little coughing. So anytime we cough, then we think, okay, whether is it the symptom of coronavirus? Means people are so much scared for anything. They feel tired because of the abnormal life we are living right now. So they feel like, okay, is this tiredness is related with something with the coronavirus? So means, what does it make really uh, related with the coronavirus, what is there any unique symptom we should look for that whether I should go ahead for the testing or not?
Yes, as I've mentioned, fever, sore throat, dry cough, uh, headaches, body aches, these are the main symptoms. And anything unusual, unfortunately, it is presenting in very different scenarios. One of the resident doctor had only headache, severe headache, which is unusual for her. And there was no other sign. She was not fever. She did not have fever. Unusual headache, and she ended up getting corona test. So yes, patients can have diarrhea, patients can have nausea and vomiting, some blood in the stool. So these are the different symptoms that you can present, and that should, fever, cough, sore throat, dry cough is the main one, I would say, that should warrant you to go and get the testing done.
Okay, thank you, doctor. Is Dr. Awasthi joined? Is Dr. Awasthi is here? No. Okay. Okay. So another question I have is if some family member is going out or they have been exposed with the coronavirus, they expect it. So how should we live with that exposed person in our home?
As I told you, try to be in a separate room, get the food very carefully, use a separate bathroom if you can, and again, or at least for 14 days, you should be quarantined 14 days. And yes, where you should be isolated in a room, and maybe give them a master bedroom. A lot of our houses in the US, we have attached bathroom to the master bedroom, so maybe let them have that so they can be themselves. If patients with coronavirus can shed the virus in their feces also, so I think you have somebody else who, yeah, so they can shed feces, and when you flush, actually the recommendation is you close your lid and then flush it, because it can aerosolize. Some studies have shown, they have done testing even on the exhaust fan, and they found coronavirus on exhaust fan. So yes, it can aerosolize. And go to the bathroom. If you're in a public bathroom, go to the bathroom maybe 10-15 minutes after anybody has used the bathroom. It can aerosolize, yes. Mm-hmm.
Okay, Meenakshi ji has joined. She has one question. Go ahead, Meenakshi ji.
Thank you for giving this insight into what the course of action should be. I have a question related to, so once the normalcy returns, basically what would happen is we'll be traveling and working the normal way. So once the curve is flattened and all the restrictions are gone, what should be the new normal way of prevention going forward in light of all this?
Yes, excellent question. Excellent. We, as I mentioned, the way this virus goes is from your nose and mouth. And people in a lot of the Southeast Asian countries, they have been using masks for so long. Even in India, they use their chunni and dupatta when they are going. So I think till the time we have an excellent hold of the situation, mask is very important. Mask. And I can send you different types of mask, but any kind of a mask, even homemade mask, I would suggest continue. We don't know how this is going to pan out, this, when we will see the decline. But yeah, even after it is done, maybe for maybe even few months, maybe weeks, month, we should wear mask. That is the number one. If you can wear gloves, depending on where you are going, where there are a lot of people and touching fruits and vegetables, then I would suggest gloves also.
Okay. Another question is related with the grocery. Everybody has to get the groceries. So just few precautions which we can do when we bring the grocery to our home, whether we should leave it in the garage for some time, or whether if we bring it, then probably wipe with the Clorox wipes or some bleach. And what about those fruits and vegetables, which means uh, if we need to wash it, that is sufficient, or something more we need to do before we can use those vegetables?
That's another very good and commonly asked question. I can just tell you, one of our New Jersey resident who's a big TV star, she stayed at home, was not going out at all, was following all the rules except that she was going for grocery. And she did get it from, most likely they're speculating that yes, she did it from grocery stores, because many people, just imagine how many people handle those groceries. Somebody is loading the truck, there's another one is unloading the truck, then they're getting put on the shelf, and then somebody's taking out from shelf and giving it to you, or delivering it to you, or you are picking it up anyhow. So a lot of hands are involved in this. uh, Once you bring the grocery, this virus can stay on steel and plastic surfaces longer, up to 24 to 72 hours. So if the things are non-perishable, like tinned food, biscuit packets, non-perishable item, or things, like potatoes and onions, they can last outside for 3 days. You don't need to refrigerate them. So you can leave it outside. This is what I'm personally doing. You can leave it outside for 3 days in your garage. You bring it, just put it outside. If you want to spray with Clorox at that time, that is even better, but leave it outside. This virus most likely will not survive after that. And then if you bring some of these fresh vegetables, now there are various recommendations. One, soap is okay. We wash our dishes, all our Indian people, we wash our dishes with soap, we rinse them in water, and we use them to eat. So we can, although people are discouraging the soap use because they are worried that you may ingest soap and that will cause another problem. So, we can be very super careful and just wash them little bit with water, but then you have to wash it very nicely with running water, warm, lukewarm running water, so that there is no soap left. If you are apprehensive about the soap, then you can mix vinegar, vinegar to 3 times of water, and then wash it. And some of the very innovative ideas that some of the people and patients have told me, they brought these big apples and oranges packs. They just put it in the dishwasher, run the dishwasher for 5 minutes, and take it out, and then individually wash it um, with the regular water. So these are all innovative things. So bottom line, if you're using soap, don't try to wash it well. But again, try not to bring all this dhania, pudina. It's very difficult to wash them. No, so try not use them as much. Some of the big, like cantaloupes, melons, apple, oranges, avocados, they can be washed very easily. But when it comes to leafy vegetables, they can be a little tricky. So you have to be a little more careful with that.
Well, sorry to interrupt. Dr. Awasthi is here on the speakerphone. If anybody has questions, he can answer. He's not able to join on Zoom.
Okay.
Okay, so Dr. Awasthi, welcome to our meeting. And from Dr. Awasthi, we want to know what is going on in India, whether they have sufficient protective equipments with them, whether if somebody is symptomatic, whether they can get some test, or how bad is the situation in India?
Thank you very much for giving me this opportunity to join your meeting. I find it very interesting. In India, we have actually quite good arrangement for the patients. First, what is done is, in every place, the entry point, at the entry point, that they look at the temperature, and there is a kind of a person first point contact who takes the history, finds out whether there has been any contact with the patient or not, with any patient or any corona patient or any visit outside the country or anybody who had come from outside the country. And then he or she is taken to a triage area where there is a isolation. They examine, the person is examined, and if there is a doubt, then it is shifted to the straight to the critical care unit. Otherwise, if there is no doubt that the patient is kept in the isolation or in the isolation rooms, which are different. If there is no immediate fever, cough, or any shadows, actually, what is done is the X-ray is taken, either an X-ray skygram is taken, or that is one way of screening them. As far as the testing is concerned, in every state, almost every alternate district has a laboratory which is doing the nasal or throat swab. They are taken and sent there, and the report is available in a day or two. In the that is one. Most of the cosmopolitan cities, like the bigger cities like Delhi, Bombay, Mumbai, we have plenty of labs there in almost all corners, and they also certain labs which are recognized, private labs which are recognized standard labs like Apollo labs, or the ones which are known to be doing tests for investigations, and they are used. PPEs is no problem. The N95 masks are no problem. The difficulty is controlling the people grouping together. In most of the areas, people understand it and they keep distance. They follow the lockdown, but still there are areas where it is difficult to keep the distance, and that crowding which occurs in some areas is the one which is adding to our number, and that is the concern. And for example, we just recently had a police officer who tested positive, became sick within a month. His first investigation was negative, and the second report after 6 days turned out to be positive. He became very sick within 2-3 days of admission, and couldn't serve. He was a young person, but because he was doing his duty in the vegetable market, he was trying to control people in the vegetable market, and it was during that process of controlling things that he had probably acquired this. So our difficulties in some of these, but I think by and large people have cooperated, they understand, and I think this kind of difficulty would arise in anywhere. I mean, you can't. Also, we have there is always people who are shifting from one area to the other. They are working in other states. If there is a lockdown, if they're going to say, they want to get back to their homes and think that they should be able to spend time with and also take care of their families back home. But there has been a very effective control. Either they've made arrangements to keep them where they are, to provide them meals, to provide them money for the next 3 months. That is how they're taking. But on and on, I think we have enough equipment, enough masks, and enough PPEs to take care of this. Hello? Hello?
Hello?
Yes? Am I audible?
Yeah, you're audible.
Yes. So I have some more questions for Dr. Awasthi. And so much dense population everywhere. Is it something different in India than US, because we are seeing so much fatalities in New York area because of having a dense population there? What makes it India different than rest of the world, especially New York and New Jersey area?
I think it is the fear factor. People have realized what is happening in what happened in Wuhan. People have realized what is happening in Italy, in UK, in Spain. So they're really scared. We are also surprised that the lockdown, which was announced suddenly, has been accepted by people most of the times. You see the difficulty in the crowded areas. The difficulty is there because, but if people stay home and if they don't get exposed, if they're like I was hearing the doctor from New Jersey telling that how to receive vegetables and wash them. So there has been so much education here on the media, in the media, on the audiovisual areas, in television, that people are they receive the vegetables, the is passed on without keeping it, and then they wash their hands, they use sanitizer. There is so much so that the sanitizer prices went up. The people got so used to it and using mask. And although they now they are using homemade masks, previously there was a rush for buying masks. So I think it is the scare factors. Secondly, they probably sort of they like to be independent and they like to be free. But I think it is the severity of the disease which has scared them. But they are following it. It's accepting for some of the religious congregations, which are mostly out of ignorance, and they are also learning very fast. And there are also people in those groups who are trying to, kind of teach them, guide them, and take them the right way. So I think we're not too bad on that. That is why it has got controlled. People have followed it.
Okay, as far as recovery time, is it same we are seeing all over the world, or some part of the world is different than the other parts as far as recovery time for the patients?
Our recovery time is actually probably the severity of the disease. It's difficult to say recovery time because it's difficult to say the recovery time. I can only say that the new cases, the multiplication of cases is much less as compared to, because we see statistics daily. The comparisons come between us, and for example, the doubling rate is now, previously it used to be second, third day, now it is 6 days. So there is an addition, there is a definite change. There are actually in almost 250, 275 cities, they have found out hotspot areas where the population is more dense, where the people have less tendency to keep distance, or they cannot keep the distance because of their financial conditions. There they are trying to give them all the help. They are giving them daily utilities and delivering them at home. They are keeping them indoors. they are policing this thing, and there's a lot of media blitz to tell them that this is really killer disease. So I think that's it. As far as the recovery time is concerned, it will be difficult to say. I think one can only say that after the epidemic is over or some statistics have been collected. That is the only one. I can't really, one cannot compare it with this thing because there are many factors. If I say the recovery time is less than the other places, maybe the severity of the cases or the general immunity of population because of other viral infections is more or whatever. It's difficult to say, sir.
Okay, Dr. Sudha has some comments.
Yeah, for recovery time, I just want to mention, I have colleagues in Boston who have one floor full of patients with COVID, and they are able to discharge them within 2 or 3 days. They just discharge them home. They admit their admission criteria is a little bit soft. They will get patients with mild fever, mild sore throat, but they are COVID positive. They admit them and they are getting discharged in 1 to 2 days also. My own colleague, she was diagnosed, she had COVID, she maybe rested at home for 1 week to 10 days and she's back to work actually. She is another hospitalist physician in Queens. On the other hand, some of these patients who, depending on their so depending on that, they are getting on ventilator, and after ventilator, it can go for a month. 2 of my another colleagues, they got infected and they have recovered, and that physician has gone back to work. And the husband is still having some symptoms, although both of them got at the same time. But they are taking almost a week or 10 days. Some of these patients from the hospital are getting discharged on 3 liters of oxygen at home. They use the oxygen and it may take 2 to 3 weeks for them to get a little bit better, but the body aches and headaches can linger a little bit longer. But loss of smell and taste is very common, but again, you do regain that loss of taste and smell after a few weeks. So recovery time can be few days to few weeks.
Okay.
No, I mean, can you just give me a minute, please?
Yes, yes.
Hello?
Yeah, go ahead.
That's a different scenario. People who have mild disease or a positive test, they go to the hospital, but it is not fair to discharge them 2 days time because one will you never know, the things start turning bad for a person after 2 days, after 3 days. So I think one has to observe them for a longer period. As far as those who are only having mild symptoms or not having symptoms, they are only come in contact. They are normally not admitted. They are sent either to the quarantine area, that is, or they are quarantined at home. So that is how it is. That is why I say that the recovery time is for a larger, maybe what Dr. is saying from New York, New Jersey, she's right because they have seen large number of patients. Okay. I'm done.
Thank you for your information, Dr. Awasthi. Now we will be moving towards the stress part of this pandemic, how to cope up with the isolation. I have a question from Acharya Brahmadevji. Acharya, go ahead, Acharya.
Yeah, namaste everybody. That is to Dr. Munjal. People are used to going out, and that has been the trend in life. Now being confined within the 4 walls of the house, it seems like a big brick on the head and on the heart. So how do we render life more lively and beat down the stress?
Well, thank you for giving me this opportunity. Like you said, human beings, they are social animal. And now that we are in isolation, that can cause a lot of anxiety, a lot of depression, and everybody is fearful. I mean, we are fearful as a physician. We doing telepsychiatry, working on the internet, which I thought I'll never do it, but we're learning it. Patients are learning it, so everybody is learning it. But isolation has some positive points. I mean, people having family bonding time, they're spending a lot of time with their children, and but anxiety and depression is going up. So best way to deal with the isolation is like we do meditation, join you guys, listen from you guys, and that's the only way to deal with it. The after effect going to be much severe. I mean, we'll see a lot of PTSD once we recover, and then there's going to be a lot of acute stress disorder right now. So every generation, they have to do their job. It's hard for the teenagers. Kids are still okay, but teenagers, they're having hard time. They want to get out of the house, socialize. But everybody is trying to understand, like Dr. Awasthi and Dr. Sudha mentioned, that fear factor is containing us. And the only way to deal with that is involving in your hobbies, doing meditation, etc.
Okay.
And remember, fear brings discipline. I mean, we have good times, we have difficult times. So difficult times, we are more disciplined, and we are learning that during good times, we need to be disciplined as well.
Okay.
Then, Doctor, I would add something. Don't we run the risk of people would be doing what they couldn't do for 1 month and try to overdo it within the next 2-3 days after the confinement is released?
Well, there could be a rebound, and that's why they're saying that the illness may come back if we don't go slow. So when they open up the economy, we still have to keep our social distance. We have to go very slow and see the effect.
Okay, I have a question from one of the audience, which says, what are the symptoms we can see in our child that they are depressed or they are stressed because of these isolations, and what should we do for that?
I mean, with children, they are fearful for their own safety, and they are fearful for the safety of the provider. So talking to them is helpful. Answer their questions honestly, whatever they want to know. You don't want to overwhelm them. You don't want to overload them, but answer whatever way you can and follow the CDC guidelines, and make sure that keep the positive attitude and focus on the strengths, not on the weaknesses. And at the end, we'll come out stronger than before. I mean, we had a lot of pandemics in the past. In 1900, we had Spanish flu, and we dealt with it. So it's going to be over. We just need to have this isolation going for some temporary period of time. And then after that, we'll recover. We'll come out stronger. So provide them reassurance, provide them support, and spend more time with them. As we are in isolation, we have nothing else to do.
So is there any specific symptoms we should look for that, okay, child needs some extra care or extra attention? Is there any specific symptoms in the children's?
Well, you could look into change in their behavior. You could all the depressive symptoms. You could look like crying spells, feeling of hopelessness, worthlessness, sleep problem, appetite problem, and they're not involving in their technology. I mean, good thing is we have technology today to connect with our friends, and that's helping a lot of people. So if they're not doing what they were enjoying, those are the symptoms of depression.
Okay, thank you, doctor. Dr. Ajay has worked in this field for and published several books also. Do you have anything to add, Dr. Ajay?
No, sir. Thank you for giving me an opportunity to talk to you guys. Just take precaution and just I'm just watching. I'm just a child in the field, normal regular member of the American Academy of Neurology and regular member of American Academy of Pediatrics. So I'm just a researcher and work as a researcher. So I'm also watching, and I see that Korea WHO is also doing an investigation why around 146 patient they got back the virus again, COVID-19 after the treatment. So they are doing the investigation. Only thing is that just take precaution, and like Dr. Sudha said earlier, just try to not to go out, and if you go out, just use, like in India, I saw in our Bangla culture in Calcutta, when they go out, they have a different clothes, different shoes for going out. When they come home, they are not allowed to enter inside the house. Even before this virus came, I remember going to Calcutta in 1990s. They were doing that time. I think if we'll follow that norms here, so that, and then most of the houses we have the washer and dryer in the garage, so we can just throw before we come inside the house and keep washing the hands. And like here, I have the hydrogen, clear what is that? Alcohol based, all the soaps and those things, liquid soaps, liquid gels, and then the napkins I have in my car also. Everywhere I keep in the every room, in every car I keep in that way. Whenever I come back, I'll wipe. Even I go to the gas station, I take out the wipes and use the gloves in my hand and wipes the handle before pumping the gas,
Okay.
and wash it again. So just take precaution. That's it.
Thank you, Dr. Ajay. Now, Dr. Munjal told us about the children's. Now, Dr. Chandora, I have a question for you for the adults, like old age people. How do we take care of those old age people, because they are more vulnerable, and it is not advised to go near him, but still they need some care. So how do we take care of our elderly people in our house? Dr. Chandora? Hello, Dr. Chandora, can you hear us? Okay.
I think he needs to unmute.
Yeah, he's unmuted. We can hear if he speaks. Okay, so while we are waiting for Dr. Chandora to come, Dr. Munjal, what are the things we can do for our elderly people in our house? Because children are still, we can take care of them, but we are so scared of this virus that we don't try to go near them, but they need also some physical and mental support from us. So what can we do for them?
Well, elderly population, they're different ball game. They're more vulnerable. So if you have a house and a basement, then you need to keep them in the basement, minimize your contact with them, and take all the precautions like CDC guidelines, what Sudha, Dr. Bansal has been telling. So minimize your contact with them, and that's the only way to protect them. And they have their own anxiety and depression, and some of them are on medication. So sometimes we have to adjust the dose of those medication. And everybody is working on Zoom and telepsychiatry. Some of them are in therapy, and they're having their therapy session on the phone or Zoom. So things are working out pretty well, but safety is the priority, and only way to keep safe is social distance, isolation, and washing your hands every 2-3 hours.
Yeah, means isolation with the adults. What are the symptoms we should look for the elderly people in our house that they need some medical attention for the stress of isolation? Is there any some specific symptoms we should look for before we go to
Yeah,
doctors?
yeah, we have all those symptoms of depression and anxiety. Their heart beating fast, they're having palpitation, they're getting sweaty, they have difficulty breathing, choking sensation, and they have fear of unknown. And there could be crying spells, like I mentioned, hopelessness, worthlessness, guilt feeling. Everybody has TV, and they're not wanting to watch TV shows, so they're not involving in their hobbies. So all those symptoms are for depression and anxiety. So we need to keep talking to them and make sure that they get help. And important thing is that we need to reassure everybody that it's going to be over, and we need to have a positive attitude. One positive thing is that whole world is united now. Solidarity has come out, so that's the positive thing. And everybody is worried about their neighbor, everybody else. So let's hope for the best and watch for these symptoms. And if you see any symptoms, then get medical help.
Okay, so we are nearing towards the end of our session today, and we have unlimited questions, a lot of things to know about. But for today's last thing, for the better note, if we can, if all the doctors can predict that when can we have next party or next get together at our home. Dr.
First,
Sudha?
can you have Dr. Chandora say a few words? Maybe on the speakerphone, if you call him on the phone.
Okay. Is Dr. Chandora here? No? Okay. We'll call Dr. Chandora.
Yeah.
This is Meenakshi. In the meantime, can you share something what we can do to build our immunity on a day-to-day basis?
That's a very good question, Meenakshi. Quickly, I know I'm going to be, time is finishing. You know what we say, turmeric is very good. Turmeric, actually, whenever you cook turmeric, the way it is absorbed best is if you add some black pepper. So if you add black pepper and turmeric together in whatever way you want to eat, that's a good thing. And take a lot of vitamin C, fruits and vegetables. In hospitals, they are giving vitamin C infusions when the patient is admitted in the hospital. So like they're giving IV vitamin C. So we have our lemons and oranges. So take some lemon oranges and breathing exercise, or alom vilom breathing exercise. And maybe next session, I'll be more than happy to demonstrate some, breathing exercise while on your belly, while you are lying on your belly. That, like a lot of the ventilator patients, they are experimenting and they are finding good results. When they put them on their belly, they can ventilate patients better, so they can kind of aerate their posterior lungs, the back of the lungs. So yeah, alom vilom exercises, stretching exercises with all the good Indian food and multivitamins.
Thank you.
Doctor, what is the belly you mentioned? Those are for breathing exercises or?
Say it again. Breathing exercises is like, there is, that in yoga, they do that alom vilom, deep breath. And, alom vilom is different, but deep breathing exercise, keep your breath as long as you can, you can hold like 10, 20, 30 seconds. Deep breathing in from nose, keep it inside and then exhale. Sometimes you can feel dizzy with this. So just don't do if you're getting dizzy, but keep the breath as long as you can. It will just expand your air passages and expand your lungs and better oxygenation.
So when we inhale, we need to expand.
Okay, Dr. Chandora, can you hear us?
Yeah, I can. I have been hearing to everybody, but I don't know whether now everybody can hear me or not.
Yeah, we can hear you.
We can hear.
Everybody can hear
Since
you.
already time has passed, I will tell you a secret so that everybody can remember. When I was at Bikaner Medical College, a professor of pathology at veterinary college was a friend, and he told me that cows which were fat, overfed, developed only viral infections, whereas the cows which were normal weight or underweight developed bacterial infections. This explains that why in India people keep on walking, they maintain their weight, not the fat, are less likely to suffer as compared to the Western, where people use mechanical means and stay on the chair, increasing the weight. So that's another secret I want to bring. And since time is up, so I want to thank you everybody.
We can extend couple of minutes if you have something more to say.
Okay, during this period, to combat the isolation, this is the best time when you can relate to your wife, because there is always complaint from the wife that doctor goes in the morning, comes back in the evening, so it is just like a hotel. So never interact, and the person, that is the wife, feels isolated more. So this is the time you can improve your relation with your wife, with your children, and also find out the purpose of life. Purpose of life is the positive relation, your contribution to the society, and what kind of time utilize for the production of means of improving the relation and your contribution. So those benevolent activities can be undertaken and have a positive wellness which will produce a resiliency and keep you healthy, happy, and enjoying relationship. And this will also heal not only the mind but the body, because during the depression it has been found that there is inflammation in the part of the brain. That's why C-reacting proteins are increased. So that has been also studied that it will be decreased. Also, from common point of view, anybody who uses large amount of vitamin C as well as vitamin D, because they have been used in China in large amount, so the people recover, because being vitamin C being antioxidant has helped them to regain the strength and overcome the sickness of virus. So anybody can use vitamin C, which is in aqueous and not going to damage anything, as well as vitamin D. So I think with this enthusiasm, inspiring to everybody, enjoy the home with the good food and relax.
Okay, thank you, Dr. Chandora.
Thanks.
So coming back to our original question, Dr. Sudha, when can we have our next get together at our home?
Well, we can, Dr. Munjal, where did he go? I can't see him. Okay.
Yeah.
Well, let Dr. Munjal coordinate with me and everybody else. I am more than happy. And, we can get more people to, any more questions. There are several questions still left unanswered at this point. We can, deal with them next time. Whenever Dr. Munjal will coordinate everything, I'm more than happy to come back and.
No, his question is different. When are you going to throw a party next time?
Oh, in the house, I thought we were talking about house means on this. Oh, please come to, I don't know, there are no parties no more in New York City for sure, and New Jersey. No more, no people, it will be a different life. I don't know how comfortable people will think about going to hotels and gathering, big parties. Let's wait for few weeks, maybe few months actually. Yeah.
So you think in few months things will be back to normal?
It will be back to normal. We have to wait for the vaccine. Just remember, Spanish flu did continue for 2 years. I
Yes.
I don't know how long, and there were like millions of deaths, and 2 years. So this is, but good thing is we have more medical knowledge now. We have this internet. We are better. So we have to wait for the vaccine. Number one, we have to see how the trend goes. Yeah, but again, social distancing will become a major part of our life. That's what I predict going forward. Yes.
So I think
So
once we find the
can
cure
safely
and
say
vaccine,
that we can safely say that until we get the vaccine or any antibiotic for that, we cannot have the get together at our home.
No.
no.
So
After
Dr. Munjal has something to say.
That's what I was saying. Once we find the cure or the vaccine, after that we can have get together.
Yes. Okay.
I
Okay.
want
So
yeah.
unless anybody else has to say anything, we are concluding this session for today's Saturday's special services from Hindu Center of Atlanta. Anybody has to say anything? Otherwise, Dr. Acharya Brahmdevji will start the Shanti part and we will conclude.
Good, thanks.
Okay. Acharya
Okay, let's sit
Brahmdevji,
down straight,
start with the
close
Shanti.
the eyes gently, deep breathing, inhale and exhale. And we'll do Shanti Path prayers for peace in the meditative mood, slow connecting each word. Om Yo Shanti Antariksham Shanti Prithvi Shanti Apah Shanti Oshadhaya Shanti Vanaspataya Shanti Vishvedeva Shanti Brahma Shanti Sarvam Shanti Shanti Reva Shanti Sama Shanti Redhi Om Shanti Shanti Shanti. Saviko Sadar, Namaste, Namaste everybody. So, surely we'll meet next Saturday. Thank you.
Thanks to Hindu Center of Atlanta for arranging the very informative session. Thank you all.